Assistant Director of General Infectious at Hartford Hospital. Welcome back.
Thank you for having me again.
How is vaccine distribution going in Connecticut at this point?
So far, we know that 214 Connecticut residents have been vaccinated, so that's definitely good news. But we still need to get vaccines as quickly as possible into people's arms, especially Connecticut residents with underlying conditions.
All right, there's some mistrust, an element of mistrust and hesitancy in the Black and Latinx communities about the vaccine. Why is that?
The answer to that question is quite complex and is rooted in the social inequities these minorities have been facing for several decades. It's really important that we engage with these communities in a way that is, approachable to them, because it's really important because we understand and know that the Black and Hispanics are twice as more likely to die from COVID than white Americans.
All right, what do you want everyone to know at this point about the vaccine safety?
There is absolutely no doubt that these vaccines are very, very effective and extremely safe. You do expect to see some side effects such as pain in the arm, some fevers, headaches, and body aches, but they fade away by day 3 and day 4 after you get the shot. It's important to know that the decision not to take the vaccine is also a decision in itself, which says that you feel safer taking your chances on a highly deadly virus that has killed more than 500,000 American residents.
All right, Hartford Healthcare is planning a series of forums about the topic. Tell us about that.
So at Hartford Healthcare, we're an organization that completely understands that it's the process of vaccination and not vaccines that leads to a successful public health strategy. And that's going to be how we're going to get our life back to normal. Keeping that in mind, we're conducting several free webinars every Wednesday starting today for the next 3 weeks from 6 to 8 p.m. Please register. It's free of cost. Go to www.hartfordhealthcare.org/virtual classes. We would love for you to join. We want to hear your questions and answer all the concerns that you may have related to the vaccine.
And doctor, you mentioned people can ask questions. What is the question you get the most as a doctor these days?
The question I get the most related to the vaccine is the vaccine safe? So safety is still the primary concern of a lot of people, especially the minority communities, regarding the vaccine. And that's why we're doing all these webinars and educational sessions to let people know that go and get the vaccine. It is very safe. It doesn't alter any of your DNA, even though it's called an RNA vaccine. And that's definitely going to be one of the ways that we'll be able to get our life back to normal.
That's a great point about the name of it and being confusing sometimes. Dr. Faiqa Cheema, thank you so much for being with us. We appreciate your insight.
Thank you for having me again.